All right, we're going to dive into something that so many people feel deep in their bones, or maybe more accurately, deep in their heads. We're talking about that link between the weather outside and the storm of a migraine inside.
You know that feeling, right? That building pressure that just seems to line up perfectly with the change in the weather. Some people swear there are more reliable forecasts than the 5-day on the news. And there's a pretty good reason for that. It turns out more than a third of people who get migraines say that specific weather patterns are a trigger for them. So that feeling, it's not just in your head. Well, okay, technically it is, but you get what I mean.
Okay, so let's get into it. What is actually going on when a storm front seems to kick off a headache? Well, the science points to this really fascinating dance between the environment and our own bodies. It all kicks off with this idea, barometric pressure. Just think of it like the invisible weight of all the air in the atmosphere pushing down on everything, including us. It's always changing, and our bodies are constantly, subtly adjusting to it. So when you see those dark clouds starting to gather, that usually means a low pressure system is moving in. And what that means is the weight of the air outside your body is dropping, and sometimes it drops pretty fast.
Now, your body is always trying to stay in balance, so it tries to match that drop. But here's the catch. The small air-filled spaces in your sinuses and your inner ear, they can't always keep up. And that creates this temporary pressure difference, a mismatch between the outside world and the inside of your head. And that is where the trouble starts. That pressure mismatch can really irritate sensitive nerves and blood vessels in your head, basically flipping the switch on the same pain pathways that are involved in a full-blown migraine attack. And then spring comes along, and it's just the perfect storm, literally. You get those pressure drops from all the rain, but you also have pollen counts going through the roof. Allergies cause inflammation in your sinuses, which, guess what, can also trigger migraines. You put those two together, and it's just a recipe for head pain. So the case seems closed, right? Pressure changes, it creates a mismatch, and that triggers the pain. It feels right, it makes perfect sense. But when you actually dig into the hard data, the story gets, a little more complicated. Yeah, even though so many people report weather as a trigger, these huge scientific studies have had a really tough time finding a consistent, solid link. The findings are actually pretty controversial, and there's no real consensus among the experts.
And here's the bombshell. A massive study published in a major neurology journal looked at this exact question. And their conclusion? They couldn't find a significant link between seasons with big pressure changes and when people were actually getting prescriptions for their migraines.
We're not talking about a small group of people here. They looked at insurance data for over 26,000 patients with migraine across Japan. And even with that enormous data set, that direct line between air pressure and a migraine attack just wasn't there. So what gives? Is this feeling that so many people have just some kind of myth? Or is there something else going on? Well, the answer seems to be that it's a much more personal picture than we thought.
And here's the thing you have to remember. Science is messy, and migraines are incredibly personal. That huge Japanese study, it had its limits. It couldn't track every little local weather change, and it only looked at migraines so bad they required a prescription. But then you have a smaller study, just 28 people who kept detailed diaries, and they did find a connection. It just goes to show you the answer isn't a simple yes or no. It really, really depends on the person. This really puts it all into perspective. Sure, weather is a commonly reported trigger, no doubt about it. But look at what else is on the list. Stress is number one. Then hormones, not eating, lack of sleep. Weather isn't acting alone here. It's just one potential piece of a very complex and very personal puzzle. So if your migraine is unique to you, how in the world do you manage a trigger you can't control, like the weather? Well, the key is to shift your focus to the things you can control. It really boils down to this clear 3-part strategy. First, ACT. This is all about healthy lifestyle choices. Since you can't avoid every trigger, building up your resilience with good diet and sleep is huge. Second, record. Just a simple diary can help you spot patterns that are unique to you. And finally, find out. This is about recognizing that sometimes the fear of an attack can become its own trigger, creating this nasty feedback loop. So what does that look like day to day? Well, here are some practical tips. If you know a pressure system is a trigger for you, maybe try to stay inside that day. Double down on minimizing other triggers you can control, like stress or certain foods. Get ahead of your allergies to reduce inflammation. And of course, always work with your doctor so you'll have the right medications ready to go when you need them. And looking ahead, this whole issue might become even more important. As Dr. Vincent Martin points out, climate change is expected to bring more chaotic and turbulent weather patterns, and that could mean understanding this link is more critical than ever.
So that leaves us with a pretty big final question to think about. Whether we're talking about migraines, allergies, or anything else, our health is clearly tied to our environment. So as that environment continues to change, how will our strategies for staying healthy need to change right along with it?